Well, tonight, Attorney General Keith Ellison says he's reviewing a New York Times investigation that put Allina Health's billing practices under the microscope. Danny Spiewak has more on what the Times reported and the fallout.
With more than 100 facilities, Allina is one of the largest healthcare providers in the upper Midwest. Now it's in the national headlines. The New York Times reported this week that Allina has a, quote, explicit policy preventing patients from getting some treatment at clinics once they reach $4,500 in unpaid medical debt. Health systems can't legally deny emergency care, but the Times found that some patients with chronic illnesses could not make clinic appointments until they paid off debt.
You know, I wish I could say I had been surprised.
DFL Representative Liz Ryer
Yeah.
helped pass legislation this session to tackle the problem of medical debt.
It's a terrible experience, and we shouldn't put people through it for spending money to treat their health, not for something they would ever have sought.
While stopping short of calling for an investigation, Attorney General Keith Ellison says he's reviewing the Times story about Allina. He asked anyone impacted to call his office so we can determine the scope of the problem and whether any laws or agreements have been broken. Meanwhile, Allina says it's, quote, in full compliance with the Attorney General hospital billing agreement and that they welcome a conversation with the Attorney General on our billing practices and our exhaustive efforts to work with patients to address financial and other barriers to care. Each year, Allina says it spends $18 million on financial assistance for more than 12,000 patients, who they say represent just a fraction of the more than 2 million people they treat.
Allina says it's very rare for patients with debt to lose access to clinic treatment. They told us that by the time somebody reaches that $4,500 threshold of debt, they would have gotten many phone calls and letters, including information about how to apply for financial assistance. Allina says it would take months for somebody to finally lose access.